I want to talk to you today about keeping your clear sight. Not just your eyesight, but your ability to see your future clearly, without fear. We spend so much time worrying about the big things, falling, running out of money, or dealing with loneliness. But sometimes, the biggest threat to our independence is small, silent, and sitting right in our medicine cabinet. You've earned your peace. You've worked hard to manage your home and your health. To keep that peace, we need vigilance. I'm talking about two extremely common types of prescription medication that can quietly, slowly steal your clear vision, sometimes without any warning sign except a slight blur when you're reading the Sunday paper. This isn't about dizziness or that temporary confusion that sometimes comes with a new pill. This is about the long-term clarity you need to keep living life on your terms. Driving to the store, reading your bank statement, seeing the faces of your grandchildren clearly, or just making sure you grab the right pill bottle in the morning light. Clear vision is the foundation of independence. When your sight starts to fade, even a little, the risks stack up fast. You misread the expiration date on the milk. You fumble with the remote control. You fail to spot that throw rug that could cause a painful fall. You lose the confidence to leave the house alone. The worst part, we often blame these subtle changes on simply getting old, but often it's a quiet chemical interaction happening in the background. We must become informed advocates for ourselves. We need to walk into the doctor's office armed with specific questions. Let's look at the first common thief. Warning 1. The inflammation fighters. Many of us deal with joint pain, arthritis, or inflammation that requires treatment. Maybe you have a persistent cough or breathing trouble, and you've been prescribed an inhaler or short bursts of medication to fight that inflammation. I'm talking about corticosteroids. These powerful anti-inflammatory drugs are miraculous for immediate relief. They help us manage pain, breathe easier, and keep moving. But if you have been on these drugs, even intermittently over several years, you must pay attention to your vision. The danger isn't the first few weeks. The danger is the quiet accumulation. Corticosteroids, especially when used regularly, are known to increase the risk of certain serious eye conditions. Specifically, they can accelerate the formation of cataracts, that cloudy haze over the lens. Or, even more dangerously, they can contribute to glaucoma, which silently damages the optic nerve. Glaucoma is terrifying because it often shows no symptoms until the damage is already severe and irreversible. Imagine trying to budget your limited retirement funds, but the numbers on the screen are suddenly hazy. Imagine trying to read the directions on a new appliance, but the fine print swims before your eyes. That's the independence that is at risk. Your doctor might be focused on your knee pain or your lungs. They might forget to connect the dots to your eyes, especially if you see a separate ophthalmologist. It is your job to connect them. Next time you renew your prescription for an inflammation fighter, even if it is just a topical cream or a puffer, ask this direct question. Doctor, considering my history with this medication, when should I be checked for drug-induced cataracts or changes in my ocular pressure? Don't just settle for a generic, "Oh, you're fine." Insist on knowing the protocol. This simple question protects your health and your money, saving you from expensive emergency eye care later. Think about the safety of your home. Clear vision allows you to keep a tidy, trip hazard-free environment. It helps you organize your kitchen, keeping the clutter at bay that can make a small home feel overwhelming and ashamed to host guests. Vision loss doesn't just hurt your eyes. It diminishes your pride and your desire to manage the small, crucial details of daily life. By being proactive about this first category of medicine, you're taking a huge step toward guarding that independence. You're refusing to let a hidden side effect chip away at your quality of life. Now, that was the first warning about inflammation fighters. The second medication we need to discuss is perhaps even more shocking, because it is so common, often prescribed to help us manage sleep or calm our nerves after facing the stresses of living alone or experiencing the profound grief of widowhood. This second medication affects tens of millions of seniors, and its threat to your vision is constant, silent, and often misunderstood. We need to talk about that next. We have talked about protecting your precious sight from the first quiet thief, often hiding in bottles you might take for allergies, bladder issues, or even to help you sleep better. Remember, this isn't about panic. It's about empowerment. It's about being ready to look your doctor or pharmacist in the eye and say, I'm aware of the long-term risk. Let's talk about alternatives. Now let's move to the second major medication concern that quietly threatens your clear vision and your independence. This concern is specific and often affects men, but women need to listen too, especially if you deal with high blood pressure or need help controlling certain muscle actions. I'm talking about a class of medications called alpha blockers. Many men over 60 take them for an enlarged prostate, also known as BPH. You might recognize names like tamsulosin or Flomax. These drugs are extremely helpful for improving urine flow. They do their job beautifully, but they have a little-known long-term effect on the muscles within your eyes. It's called intraoperative floppy iris syndrome, or IFIS. What does this scary name mean for you? It means that the tiny muscle that opens and closes your pupil, the iris, can lose its firmness and elasticity. The drug changes the muscle structure. The problem often doesn't show up until years later, when you eventually need cataract surgery. And nearly all of us will need cataract surgery someday. When the surgeon is operating on your eye, that floppy iris can complicate the procedure significantly. It makes the surgery much riskier and more difficult for the doctor. This medication is a quiet thief because it doesn't cause sudden blurriness today. Instead, it quietly compromises your future options and increases the risk of a procedure that is supposed to restore your clear vision. This side effect can be permanent, even if you stop taking the medication months or years before the surgery. This is exactly why that little yellow pill you took 5 years ago for prostate troubles is still a vital piece of information for your eye doctor today. You must bring up this history. Your eye doctor might not ask unless you prompt them. Protecting your sight is protecting your entire world. It's protecting your ability to read the labels in the kitchen, spot a tripping hazard in the hall, and see the faces of your grandchildren clearly. When your vision is compromised, independence is the first thing that slips away. And when vision fades, confusion and clutter can move into your peaceful home. That blurriness makes it hard to manage bills, sort the mail, or even know which medication bottle you are reaching for in the morning light. Clear physical vision must match clear financial vision. If you struggle to see the fine print on a bill, or the stack of unopened envelopes on the counter makes your stomach drop, please take 15 minutes this week to address the one bill that causes you the most anxiety. Don't ignore it. That only makes the financial tension worse. Instead, pick it up, find the phone number, printed clearly at the top, and call them. You don't need to yell. You just need to ask one simple question. Can you please explain this charge to me in plain language? Often, a simple, clear conversation can dissolve the confusion. It brings relief, and relief brings peace back into your living room. A clear line of sight, physically and financially, is true aging wisdom. We have addressed the two quiet medicine thieves threatening your sight and reinforced how crucial simple health action is for a calm home and secure finances. But there is still a hidden danger waiting in your daily routine, something most people over 60 do every single morning that dramatically increases their fall risk and the likelihood of needing a costly hospital stay. We must address this critical, common daily habit next. We've talked about the quiet threats hidden in the medicine cabinet. We've covered how certain common pills can dim your world, blurring the edges of your independence. But knowing the threat is only half the battle. The other half is taking control back. This is where true wisdom shines. It's not about fighting your doctor, it's about partnering with them. Many seniors worry about sounding demanding or complicated when they see the physician. You feel rushed. You think, my symptom is probably nothing. Stop that thought right now. Your health, your vision, and your independence are worth the time. Before your next appointment, commit to this simple ritual. Get a piece of paper. Write down every single pill and supplement you take, dosage, frequency, and why you started it. Don't rely on memory. Next to the names of the medications we discussed, the ones linked to dry eyes and cloudy vision, write down exactly what you're seeing or feeling. Don't just say, my eyes are dry. Say, I had trouble reading the small print on the bank statement this week. Or, I almost tripped on the rug because the shadows looked warped when I walked into the hallway last night. Specific struggles unlock specific solutions. When you speak to the doctor, lead with this. I read that X medication can sometimes affect vision long term. I want to protect my eyes and maintain my independence. Can we review the specific dose or explore an alternative? This approach isn't accusatory. It is proactive and respectful. You are showing them you are serious about managing your health, not just masking symptoms. The doctor may suggest simple fixes first, maybe lubricating drops or minor dose adjustments. They might switch you to a completely different class of medication. Be open to the process. This takes time, patience, and gentle persistence. Protecting your clear vision is protecting your future. Now let's bring this wisdom home. Clear vision is tied directly to a safe home, and a safe home is where true peace begins. If you know your vision has been compromised, even slightly, due to medication side effects, you must adjust your environment immediately. This is home wisdom protecting health wisdom. The number one culprit for trips and falls in seniors is poor lighting combined with poor contrast. When your medication makes your vision fuzzy, these risks multiply. Walk through your home today. Focus on the walking paths you use at night. Start with the bedroom to the bathroom. Are those paths well lit? Put simple plug-in nightlights along the baseboards. They are inexpensive and essential. Don't rely on the moonlight filtering through the window. Look at your rugs. If you have throw rugs or runners that are the same color as the floor, they disappear to a fuzzy eye. Pick them up or secure them aggressively with non-slip backing. Better yet, if you can, remove them completely from major paths. A clean floor is safer than a decorated floor. In the kitchen, think about contrast. Are you pouring boiling water from a light kettle into a white mug? That lack of contrast is dangerous. Use darker mugs or plates against a lighter countertop. Small details like this save you from burns and painful spills. Vision protection is fall prevention. Fall prevention is independence preservation. And this leads us straight to our Money Wisdom segment. You might be wondering, what does replacing a throw rug have to do with my retirement savings? Everything. A trip and fall, even a moderate one, is the quickest, most expensive ticket to losing financial security after 60. Hospital stays are ruinous. Rehabilitation costs drain savings faster than almost anything else. If you lose your mobility, you may need professional help at home, which adds thousands of dollars a month to your expenses. Investing a small amount today in better lighting, medication reviews, and grip rails in the bathroom is the wisest financial decision you can make. It is prevention that saves your principal. Don't wait until the bill for a broken hip arrives to realize the wisdom of preparation. Think about the prescription glasses themselves. If your vision has changed because of medication, that $400 pair of corrective lenses you bought last year is now useless or actively hurting your eyes. This is money wasted because the underlying medical problem was not addressed. Protecting your vision is the foundation for all clear decisions. Knowing where you are stepping, knowing what numbers you are signing, and knowing which pills you are taking. We have addressed the critical medication threats and the home adjustments required to keep you safe and solvent. We've empowered you to speak clearly to your doctor, but sometimes the biggest threat to clear thinking and a peaceful life isn't a physical pill or a slippery rug. It is a quiet, internal habit, a routine we adopt that dulls our emotional edge and makes us vulnerable to financial and familial stress. This habit costs you dearly in energy and peace of mind every single day. Join me in our final segment. We will look closely at this subtle destroyer of inner calm, and I will share the simple steps to reclaim your mental clarity and emotional security. We've talked about the quiet ways certain prescriptions can dim your world, but knowing the risk isn't enough. True wisdom means setting up shields. It's about building layers of safety so you never have to choose between managing one condition and losing your ability to see the faces you love. We often focus solely on the doctor, but your pharmacist is your second line of defense. They are specialists in drug interactions, Don't treat them like a cashier, simply ringing up a bottle. When you start any new medication, or even when you refill an old one, stop and ask this key question. If I combine this with everything else, what is the single biggest risk I need to watch for that is not stomach upset? Listen carefully to their answer. If they mention dryness, light sensitivity, night blindness, or blurry vision, write it down immediately. Put that warning on your refrigerator. This simple step turns passive worry into active protection. Now let's connect clear vision to financial wisdom and independence. Think about the ripple effect of poor vision. It's hard to manage bills accurately if the fine print on the statement blurs. It's easy to confuse two similar-looking pill bottles in the dim light of the bathroom cabinet. Medication errors are costly, in health and in money. And falls? A fall doesn't just hurt your hip. It empties your savings account faster than almost anything else. If you can't see the lip of the rug or the slight change in color from the floor to the baseboard, you are vulnerable. Protecting your eyes is one of the cheapest ways to protect your bank account. Look around your home right now. Are your lights bright enough? Spend a few dollars on higher wattage, daylight spectrum bulbs in the kitchen, the bathroom, and especially near your reading chair. Better light prevents falls. Better light prevents medication mix-ups. This is the difference between surviving on your retirement savings and spending it all on emergency room visits. Dignity and independence rely on sight. When you lose clarity of vision, you start to avoid things. You stop driving at twilight. You stop trying to read the tiny print on the church bulletin or the menu at the diner. You stop going out. Loneliness creeps in because the world feels too risky to navigate alone. The shame of constantly needing help to read a label or verify a dosage is real. Protecting your eyesight is protecting your social life. It's protecting your ability to read the comforting words of an old letter, or to simply see your grandchildren's expressions clearly when they visit. Take charge of the medicines that are supposed to help you. Review your list. Make that call to your pharmacist this week. Insist on clarity in your vision and in your plan. But before we close out this important discussion on health and independence, there is one simple daily habit we often overlook. One thing we do every morning right after breakfast that could be silently undermining the effects of alternatives. These protective measures we just discussed. It's not a medicine, but it interacts with every pill you swallow. It's draining your energy, affecting your balance, and making your home feel subtly chaotic and tense. It directly impacts your clarity of mind and your financial confidence. We need to talk about the quiet clutter hiding in plain sight, the secret saboteur of peace in your home. That crucial warning is next.